Welcome to your medical huddle for November 7th through the 14th. I'm Ricky, your nurse manager. Just a reminder that unit cleanliness is important to all of us. So make sure that you have integrity and you're doing the right thing, because it's the right thing to do. That when you're going around the unit, if you see something that's out of place or things are just looking messy, that we're taking the time to make sure that our unit is clean and tidy, and that goes for patient rooms as well. As if you notice that there's clutter and linens and things like that laying around, it's super important to make sure that we are making the environment a healing environment and a welcoming environment for our patients and families. So make sure that you guys are doing that. We are in our window for JACO that, we want to be prepared that we aren't having cups with no lids and syringes laying around and that kind of thing. I happen to notice when I'm walking around the unit, we end up having like paper clips and rubber bands and sometimes tissues laying on the ground, and maybe I just look down too much when I'm walking. But anyway, just have a taking pride in our unit, so making sure that the unit is clean is super important to everyone. Innovation, just a reminder that there is a national shortage with the 1 liter normal saline bags. So if you're needing to resuscitate a patient, it's probably a good idea to ask your physician if you can use the lactated ringers in place of the normal saline. We still have the 250 to 500 normal saline bags that you can use as a carrier, so just keep that in mind. Starting next week, we will be implementing a nurse sensitive indicator. So nurses, you'll be getting these with your assignment. It's this worksheet here that covers skin safety, falls, C. diff, CLABSI, and CODI. So be on the lookout for that. Tele boxes go live next week, remember? So a couple weeks ago you got an email from Janet telling you about the education on ULearn that needs to be completed by the 13th. So make sure that you guys have that done. And then we also are having a PCT meeting on Monday the 13th at 7:30 to 10. So please make sure, PCTs, that you guys are able to attend that. Lots of good stuff coming out of that meeting. For staff recognition, we work with so many amazing people that we have the Wall of Fame nomination forms on the source that you can go and fill out and turn in by November 24th. If there's somebody that you want to nominate, remember, it's not just clinical. It can be environmental services, somebody from dietary, anybody that you feel that makes your workload easier. That definitely demonstrates our values: patients first, integrity, and excellence. You can fill out this form. If you feel like you want to nominate somebody and you don't have the time to, I would be happy to help you with that as well. That's all I have. So I'm going to turn it over to your charge nurse for any current patient safety quality concerns. As always, I encourage you to subscribe to our MCR Medical Unit YouTube channel. You guys have a great shift.